Good afternoon. It's December 11, 2025. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. We're here at the Deuk Spine Institute performing spine surgery. Our patient has had back pain for many years. He's here at the Deuk Spine Institute to have his back pain eliminated, and that's what we're going to do. There are 2 discs that are damaged, and he comes from Florida. He's a local, but he is also allergic to iodine. Therefore, we are not going to use any iodine products. For those of you who are regulars watching our live spine surgery streams on Facebook, YouTube, or X, Instagram, you normally will see a dark color here because we use an iodine impregnated material that reduces the risk of infection. On the other hand, he is allergic to iodine. We don't want to elicit a reaction, so we're going to instead use chlorhexidine prep, which does not have iodine. Many patients have iodine sensitivity or allergies, and in medicine we have to be aware and accommodate. So I would love to. All right, if you have questions, feel free to type them up in your dialog box. Henry will ask me your questions and I'll answer them for you. But right now, I've got to get this needle into 2 discs, actually 2 needles into 2 discs, this one into L5-S1. And then we'll be ready to do surgery. So in the meantime, Henry, if you don't mind, share with our audience, how back pain is caused by these 30 different causes. What's the mechanism by which these structures in the back cause back pain? Because back pain has very specific causes. And at Deuk Spine Institute, we know these causes and we fix them all the time. Shot? I'm Dr. R. Deuk Majan with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Welcome back. I'm Dr. Deuk Majin. Our patient is from Florida. He's had back pain for many 20 years, folks. 20 plus years. Pretty common for the patient with chronic back pain. And by the way, I'm going to just put a C there for chronic. Chronic means going on for more than 2 weeks. Now, to fix back pain, you first must diagnose the source. We showed you a video earlier on the 30 different structures that are causing back pain. Those 30 structures can be identified anatomically by a good doctor who understands those sources and where they are. And then you can actually test, if you have to see whether those structures are causing the back pain. We don't need to do that. We're very confident that these 2 discs are the cause of his back pain. One test we can do, though, is called a discogram. We're going to do that right now, but the patient has to be awake for that. So we're waking him up. Now, some of you may be saying, Dr. Deuk, what is this surgery? This is endoscopic, ultra minimally invasive endoscopic spine surgery. Now, I don't make these names up. Other people do. But the reason ultra means it's the most minimally invasive, and it is. But other doctors will call their surgeries ultra when they're not. Our incision, you're going to see, is 7 millimeters. It's right there. The entire surgery on his back will be done through that incision. If you go to another doctor, he may say, well, this incision is ultra minimally invasive because it's smaller than, well, this incision. But it's all semantics, right? In the end, it's not really the size of the incision that matters. What matters is what's done underneath the incision. So these doctors are using ultra minimally invasive, this incision and that incision, to distract you from what they're actually doing underneath. It's actually underneath the skin that matters. That's where your muscles are, your ligaments, your tendons, your bones, and your joints. And those surgeries, other than the Deuk laser disc repair, which you're about to watch, are highly invasive and most importantly destructive of normal tissues. around your spine and in your spine. The Deuk laser disc repair, this surgery we're doing here at Deuk Spine Institute, doesn't do any damage to any of the structures around the spine. It's the only surgery that doesn't do any damage because we go transforaminal. Very difficult to do. There are very few doctors in the world that know how to do this, probably less than 10. And there's less than 10 doctors that do this surgery routinely in the world, in my estimation. Any questions?
At this moment, no current questions.
All right. While we perform our discogram, go ahead and show the audience how it is that a damaged spinal disc can become so painful and cause chronic lower back pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video how discs cause chronic back pain. It's a tear in the back wall of the disc called the posterior annular tear. And having an annular tear isn't enough to have back pain. You actually have to have inflammation, active, ongoing inflammation within the tear. If you have active, ongoing inflammation in the tear, and what causes that is the herniation stuck inside the tear. So you have to have an annular tear with a posterior herniation, like what's called a disc bulge, and that's what causes the back pain. This diagnosis has eluded doctors for hundreds of years. Hundreds. And only a few surgeons have ever come close to figuring out the cause of back pain is the disc. One of them was Dr. Cloward, a neurosurgeon who was testing discs in patients' back during surgery. He would do laminectomy, and during the laminectomy, he would actually push on the back of the disc where he thought pain was coming from, and it would elicit pain. So pressure with his probe on a bulging disc in a patient with back pain would elicit back pain. No surprise, we now know at Deuk Spine that discs do cause back pain. Unfortunately, my colleagues, other neurosurgeons, neurologists, physiatrists, interventional pain management, orthopedics, you name it, those doctors have no clue what causes back pain. They've never studied it adequately to figure it out. At Deuk Spine, we looked at 5,000 patients with chronic back pain and discovered that the disc was the #1 cause in 85%. Followed by facet joints, followed by the piriformis muscle and the sacroiliac joint. Between those four things, piriformis, SI, disc, facet, that accounts for 99.5% of back pain, chronic back pain, okay? Now notice I didn't say muscle, I didn't say fracture, I didn't say tumor, I didn't say infection, because those are extremely rare causes of chronic back pain. The reason people get an infection, they go see the doctor, they diagnose it, they treat it, it doesn't cause chronic back pain once it's treated. Fractures are treated today with kyphoplasty, with vertebroplasty, with surgery, and the pain goes away. Most fractures heal themselves on their own. However, disc injuries do not. Let's show the audience how we use the endoscope and laser to clean and debride the tear in the back of the disc, the tear that's responsible for back pain and neck pain by anyway, also neck pain.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Dr. Berndes and I were just discussing this patient, and you've now watched our videos on the 30 different causes of back pain, the chronic back pain, and what they are. We have 10 facet joints in the lower back that can cause back pain. The most common facet joints to cause back pain are L4-5, followed by L5-S1, followed by L3-4. The next would be your 5 discs. You have 5 intervertebral discs. They are joints between your vertebral bodies. Vertebral bodies transmit 85% of your body's weight through the disc. 15% of the weight goes through the posterior elements, which is the facet joints. And it turns out that those discs can be damaged and cause back pain, just like the video you just saw. When you have a disc that's causing your back pain, the only way to get rid of that pain is to operate on the disc. That is what we are doing right now. We are doing the Deuk laser disc repair. We're repairing the damaged discs that are causing his back pain. Being able to diagnose the disc as the source of back pain requires a lot of expertise on the part of your doctor. We do it through something called the Deuk spine exam. It's a special examination that uses a combination of physical exam along with diagnostic imaging, along with history to properly diagnose the source of a patient's back pain. He's not liking this. You finally got him awake. We got 2 discs to fix in this patient, L4-5, L5-S1. They are the 2 most common discs to be painful. Okay, so if you have back pain or neck pain coming from a disc, there are very specific discs that are the most common to be injured and cause pain. And in the lower back, it's the number 4-5 and L5-S1, those 2, in that order, by the way. In the neck, it's number 5, 6, and 6, 7, in that order. But you don't have to diagnose yourself. Deuk Spine Institute can do it for you. We just need you to do our free MRI review. We don't charge you, the patient, for the most valuable information you can get from us, which is what's causing my back and neck pain. That's for free. Any questions?
At this moment, no current questions.
Well, let's show our audience the Deuk laser disc repair versus other types of treatments that other doctors often recommend that really are not appropriate for back pain. Hi, I'm Dr. Deuk Majin. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain, and that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. You pick the treatment. It will not cure back pain unless it's one of the treatments offered here at Deuk Spine Institute. Deuk Spine Institute is the first facility in the world that has the treatments needed to cure chronic back pain in 99% of patients suffering with chronic back pain. Same thing with neck pain. It turns out neck pain is caused by the same things that cause back pain, disc injuries, and facet joint injuries. Those disc pain and facet pain can now be cured at Deuk Spine Institute with one of our proprietary and patented treatments. FDA approved, of course, provided here in Florida at the Deuk Spine Institute. But you need to be ready to travel to Florida to have your procedure done. Your doctors where you live will not offer these treatments. They don't. Unfortunately, most doctors choose treatments that they're comfortable with, not treatments that work for you. And what makes doctors comfortable with treatments, unfortunately, is often how much money they're making to do the procedure on you, not whether or not you get better. But maybe times are changing. Medicare apparently is now wanting to reward doctors for treatments that actually work to eliminate patients' symptoms and manage them properly. And one of those conditions is pain. So maybe the entire insurance industry is going to wake up and start to pay for treatments that actually work, not treatments that don't work. We'll see. Time will tell. These are decisions made by powers much greater than myself, but if they'll pay for people's back pain to be cured or neck pain to be cured, then Deuk Spine will definitely be treating patients to help them get out of pain, because that's why we're here. All right, any questions?
At this moment, no current questions.
How's the blood pressure? Coming down. All right. I think that under 120 is okay for us to move forward. Let's keep it down. All right. We have fixed one disc. Now we're going to move on to disc number 2, which is the L4-5 shot. Now L4-5 is the most common disc to cause back pain, and it must be injured. You must have a bulging disc, herniated disc, ruptured disc, protruded disc, extruded disc, degenerated disc, slip disc, spondylitic disc, in order to have symptoms from the disc. So, a disc that has zero injury at all cannot cause back pain. The disc must be injured to cause back pain. Was that other dilator that I couldn't get the needle in last surgery?
It was bites.
It was from the vice grip.
Yeah.
That's what I thought. All right. If you have questions, feel free to ask. But Jordan, show the audience the guide wire inside the L4-5 disc. Yes. Show the dilator sliding along the guide wire. Notice how the dilator's tip is pointed like a pencil. It does not cut. It spreads tissues. That's because everything inside your body is fibrous. Show the guide wire inside the dilator. Gobble, gobble, gobble. The dilator eats the guide wire, slides along it, and the guide wire guides the dilator to the right place, but also along the right path. Yes, the guide wire is a guide. Remember, a guide must not just get you somewhere, but it has to get you there along the proper path, right? Well, when it comes to spine surgery, there are many things along the path that we don't want to encounter. Blood vessels, nerves, etc. And the guide wire ensures that the dilator travels from here to the disc along the right path, so that there's no damage to nerves or blood vessels or any other structure that we don't want damaged. Now, of course, you can't take what I'm saying and just go stick a guide wire in someone's back blindly and then put a dilator and say, hey, Dr. Deuk said if I stick a guide wire first that we won't damage anything. Of course you're going to damage things. You must first place the needle, and the needle placement is the hardest part of the surgery. The rest is easy because once you place the needle properly, the rest of the surgery is easy to do, unless you're an anesthesiologist. And then it's not so easy. Thank you, Dr. Berndes. You are the man. By the way, one of our patients just made the very best crumb cake that I've had in 40 years. Crumb cake, 40 years. I used to get my crumb cake from New York, from a bakery called Anderson's Bakery over in Queens when I was a kid, and it was the best crumb cake ever in the world. The best dough, the best crumbs, thick crumbs piled high, a little crispy but not soggy, cinnamony and sweet and delicious. But then Anderson's went out of business many years ago, and I've been looking for the best crumb cake since then. And our patient just brought it to us. Can you believe that? I'm so happy. I don't want to mention the patient's name, obviously. Maintain their anonymity for violations of federal laws. But the crumb cake was phenomenal, phenomenal. All right, any questions?
At this moment, no current questions.
Henry, you're originally from New York.
I am.
You must have had really good crumb cake when you were young.
Nothing like nothing like this week.
Yeah,
I'll tell you that.
the crumb cake we just had is amazing, huh?
Yeah.
Best I've ever had.
Yeah.
How about you, Nikki? Dr. Berndes is asking if there's any left. My answer would be crumbs.
I can check. Hold on.
Just crumbs. But I have good news for everybody, especially crumb cake fanatics like myself. I am commissioning the patient to make 5 crumb cakes for us. Well, not all 5 for us, but I do have to give some to my family. But I'm going to commission some crumb cakes.
Good news, there is a little bit more left if anybody else wants it.
Save a piece for Dr. Berndes,
I will
right?
do just that.
Yes? All right. Now, I think I had your wife's baking. Yes? Was that it? Yeah, and the peanut butter? Oh, no. Well, here's what's happening. The OR staff are hoarding her treats that she's bringing. And I'm not seeing them. And I'm about to go thermonuclear. Hiding treats from me. Huh? That's something we don't do. Okay, look here. You guys see the pink area right there? That is the inflammation right inside the tear. That's where his back pain is coming from. Remember, we are at L4-5. We've already done L5-S1. It doesn't do you any good to tell me there's cookies when I can't find them because they're being hidden by the staff, by certain staff. All right? As a matter of fact, it's better that they remain hidden for my diet. However, if they're going to hide them, then don't tell me about them. That way I'm not yearning for them. Where are we at, Henry? Are we on a video or are we just streaming?
We're streaming. I just put a crumb cake together for Dr. Berndes on a plate.
That was very sweet. You've just made a new friend.
I got you.
If you ever need anesthesia here, Henry, I'm sure Dr. Berndes will make sure you don't remember anything about the surgery.
That sounds great. Thank you.
Did I tell you about the anesthesiologist that worked here once, and only once? He would do the anesthesia, but the patients were awake for the whole surgery. I said, why is the patient awake? He said, if I put him any deeper, it becomes dangerous for the patient. Of course, I realized what he was really saying was he wasn't comfortable doing anesthesia. Right? All he was doing was monitoring their heart rate and watching them squirm. I never brought him back again. That was the only time I ever used that guy. Remember him? Luis? You don't remember? Yeah, I remember him. Is that the one? I think there were like 5 cases and he maybe used, whatever the minimum. Yeah. Well, he was just, not comfortable with prone sedation, It does. That's no joke. I thought every anesthesiologist could handle it, but, Yeah, but, these guys ask, what kind of cases do? You tell them, are you okay with that? And they're like, yeah, I do. I've done a lot of that. I always ask them, have you done propofol sedation, prone? Yeah. No problem. They just want the money. And then they think I'm not going to notice the patient squirming, right? There's a lot like that. We had a lot more bad anesthesiologists that I got per diems, It seems like the per diems are pretty bad. There's only a few. In my experience, most of the hired them for one day anesthesiologists are not competent. Then again, that's why they're hired for one day, right?
Why they have to go through like a contract, like a third-party contract.
The insurance companies don't really care one way or the other unless they cause complications. And then they care. Because complications cost the insurance companies money. And they don't want to pay that money. Any questions?
We do have a question. This is coming from Stuart on Facebook.
Hello, Stuart on Facebook. Welcome.
I'm a little confused on it, but he asked, phone is lying on your stomach, correct?
This patient is lying on their stomach. That's correct. And they are on foam. Yes.
Oh, foam. Okay, yes.
Yeah, we have them padded. It's not just foam. It's more than foam, but it's a special operating table. Is this the Jackson? No. It's a 3080 bed that has special foam, and they're padded up really good so they don't get a decubitus ulcer. Oh, yeah, sorry, prone. If you ask prone, yes, they're prone. This patient is prone. All of the laser surgeries done on the lower back and the thoracic are prone. And for those of you who missed it, this week we had a patient from Kuwait, South Africa, Kentucky, Puerto Rico, and then some Florida patients. And our patients from Tuesday are all doing amazing. Their pain is 100% gone. 100%. Every one of them. 5 surgeries. One of them is coming back today to have his neck fixed. That'll be our next surgery, our last surgery of the day. Any other questions?
At this moment, no current questions.
Deuk Spine is bringing the world together and making the world a smaller place. We have patients from all over the world coming. All right, just about finished. Dr. Berndes, 5 minutes, 5 minutes. Less than 5 minutes, maybe. This is the end of the herniation and the tear right here. You can see, compared to the last disc, there's less scar tissue. Less scar tissue here.
I just got an interesting text message from my wife.
Okay.
I told everybody at the office to save some of all the cookies without forgetting.
Listen, have you ever heard the saying, all's fair in love and war? Okay.
So she just said it at that.
Tell her, please text her for me, and tell her I had her cookies. I had one of them, and it was amazing. It was perfect. Of all the peanut butter chocolate chip cookies I've ever had, that was the best one. And I'm very thankful that my staff hid the rest from me, because otherwise my sugar would go up to 400.
Wait till you try this other one she brought over. I think this is her number one.
That's probably why I couldn't find it.
All my sons say this is the best cookie they've had in their lives.
Listen, I'm saving myself for her burritos
That's coming Tuesday.
and enchiladas. What does she make the best?
I personally think her green chili enchiladas with chicken.
Oh, chicken enchiladas, green chili.
She really makes the
Okay.
best enchilada I've ever heard. But she makes very good burritos too. She makes you
Listen, I love enchiladas. Don't get me wrong. Yes, of course. The only thing I don't really care much for is, well,
she makes it with green or red sauce.
I'm not crazy about chili relleno, but I'm sure it's because I haven't had really good chili relleno.
You gotta go to Vegas for that. The best I ever tasted.
Really? Best chili rellenos are in Vegas? Where? Where?
Roberto's.
Oh, Roberto's. Get out of here. I grew up on Roberto's, but in San Diego. It's the same company. It's a chain. Oh, yeah. Oh, my God, yeah. I love Roberto's.
You like it?
I've not had their chili relleno. Every time I went to Roberto's in California and San Diego, I had machaca burrito,
All the machaca.
and I had carne asada burrito. Carne asada and machaca. That's it. That's what I lived on. Oh, tell me about it. What do you mean homesick? You're home.
I know.
Don't give me that crap. You're not in Vegas anymore, my friend. Florida is home. I was watching the news last night, Fox News, and there was a commercial for Homeland Security from what's her name? The woman in charge. She's from like South Dakota. What's her name? Christy Nome. She's on a horse. She's talking about how the laser's not coming on. She's talking about how illegal immigrants should just report themselves and send themselves back to their country. And if they do that, they'll have a chance to come back here, right? And then she says, for me and Donald Trump, welcome home, right? And I just thought it was funny because if you understand what she's saying welcome home as in we're going to catch you and we're going to send you back home. She's not saying welcome home to the United States, saying welcome home to wherever it is you came from. We're sending you back. It's an interesting play on word expression. Anyway. All right, Henry.
We have a few questions.
Wonderful. We're just about done, by the way, folks. We are literally, the laser, by the way, before I take your questions. As a matter of fact, you know what? I'm just going to come over there and take their questions.
All of these are from Stuart, by the way.
Well, Stuart, rapid fire questioning, no problem, buddy. Semi-automatic, I love it. I'm going to come answer Stuart's questions face to face with you, the audience. You're going to get to gaze upon my unshaven face, okay? And you're going to feel me. But before I take Stuart's question, let me tell you what we got going on here. That laser fiber, the glass part, the clear part you're seeing coming out of the blue, that is 1 millimeter, 1 mm wide. That's the diameter, not radius, diameter. So that gives you an idea of just how microscopic everything is here that we're looking at. But of course, the endoscope is even more able to see magnified, illuminated views than the microscope. The microscope, you can't put that microscope inside someone's disc. Only the endoscope can go inside a disc. Therefore, the only tool that really gets this kind of view is the endoscope, and that's what we're using. Now, our endoscope is high definition, meaning that you can see all kinds of little nooks and crannies and things. That makes the surgery better. That way I don't remove anything that shouldn't be removed, and I remove everything that should. So it helps me with my accuracy and precision using the laser. Now notice how I use the laser for the whole treatment. This is not fake laser spine surgery. This is the real deal. We do real laser spine surgery. We don't advertise and do that we do it and then don't do it. We do it every single day of the week. But we're operating, we use the laser because Deuk Spine Institute is the epitome of laser spine surgery. Now, other doctors don't like me to say that to you because it's true and they don't want the truth getting out. The truth is Deuk Spine Institute is the world's leaders in endoscopic laser spine surgery. Okay? And we're providing patients with the best results possible. That said, I am done. We're done debriding this tear with the laser. The Deuk laser disc repair is an annular debridement, removing the herniation and cleaning the tear so that it will heal naturally on its own. That is the tear right there, right where I'm at right now. It's pressed up against the L4 vertebral body. So in his case, his annular tear was high in the annulus, not in the middle. It was high as it exited the disc, right up against the end plate of L4. Remember, he has an allergy to iodine. We're not using any iodine. We're only using non-iodinated products. That's why it looks a little different. I'm going to come and answer questions, so type them up. In the meantime, Henry, why don't you share with our audience one of our patients who recently had the Deuk laser disc repair for back pain. And good morning. It is now March 6, 2024. I'm Dr. Deuk Majin, and I'm here with a patient of mine who wants to share her story. She had a back injury. She had a herniated disc, and it was pinching the nerve going down her leg. And I'm going to let her tell you more about it. But just yesterday, 12 hours ago, she had the Deuk laser disc repair at L5-S1. How do you feel today?
I feel amazing. It's literally a day and night transformation. I was bedridden since like December up until the day that I came and did the surgery. I had it yesterday. The relief that I felt after the Deuk laser disc repair, it's day and night. I'm walking. Like I was able to, do my hair and, fill in my eyebrows and, maybe it's too much information, but,
You're
get
smiling.
ready. Yeah, but get up smiling.
You were not smiling.
I was not
when you
smiling
first
yesterday.
Came here, so.
No, I was so miserable and I'm so grateful that you do what you do. And if, oh my gosh, I'm so grateful. And I feel like my prayers have been answered and I'm so happy. I'm so happy.
Now you came far away. You came from Pennsylvania to Florida for the Deuk laser disc repair. Why did you come so far?
I wanted to get surgery because I felt like everything that I've tried, the physical therapy, the chiropractor, the pain medication, it wasn't helping. I was even doing like at home stuff, more conservative treatments with the McKenzie workouts. Nothing would alleviate my pain. And I saw the surgery that was out there, the opening of the backs and just a different type of surgeries. And too, like my father has back conditions and he told me about his experience when he had his fusion and how it took him months to recover and to get better and he wasn't able to move. And then I said, there's no way. I have 3 kids. I have to be a mom and I have to take care of my house and, not depend on everybody else to do things for me. To be honest, I was Googling another chiropractor on YouTube. Dr. Deuk's video came up with a testimony and I decided might as well watch it. I'm watching everything else, right? So I watched it and I couldn't believe, I was like, wow, is this really real? And then I started watching the surgeries because he does the surgeries live and, hearing Henry and hearing Dr. Deuk. And I love the entire interaction with answering questions. I was able to even ask questions during the live feeds. And I was just convinced that this is for me. I'm next. I'm going to sign up and I did the MRI review.
And I'm smiling because it's really special when one person's testimony or sharing their experience, and now here you are, you watch theirs and now you're giving yours because they helped you to see the right path, right?
They did.
You're crying because you've been in pain and suffering for so long, right?
Too long.
Nobody should suffer like that. Get it fixed and get it fixed the right way. Do you feel you made the right choice coming to Deuk Spine?
Absolutely. Absolutely.
If you had to do it again?
I would do it again. 1,000%.
Well, you're not going to have to do it again. Right? You're gonna follow the instructions, and you're gonna have a great life and not have to worry about your back anymore. Go take care of your kids.
Thank you.
Okay? You're welcome. It's
Thank you
my
so
pleasure.
much. Thank you.
My pleasure. You're welcome.
This is the right doctor. If you have back pain, this is the right doctor. He will fix you.
We have a great team here at Deuk Spine.
They
and
do.
We love what we do, and we love this right here. We love getting people their life back. That's why we do it. It's the greatest gift in the world that we could ever have. Thank you for sharing it.
Thank you.
Thank you. All right. Come on, let's get you out of here. Hello, everyone. Dr. Deuk Machen, CEO and founder of the Deuk Spine Institute. Yes, we've just completed another successful treatment of back pain in a patient who comes all the way from down the street. Actually lives close by, unlike many of our patients who travel. This week we had a patient from Kuwait, another patient from South Africa, and another patient from Puerto Rico, one from Kentucky. We've had people from Israel and China, Japan, South America, the islands, India, all over the place. Australia, Iranian. Oh yeah, we had a Iraqi patient a couple of weeks ago, a doctor. But anyway, hello everyone. I'm Dr. Deuk Machen. I'll be here to take your questions. I understand we have a slew of questions from some of our viewers, but I just wanted to tell you this patient's finished. We fixed 2 discs with a laser endoscopically. We could see some inflammatory tissue located in the tear. That was our target mainly, but also to clean the tear so the inflammation goes away and stays away. Yeah, the patient will be here for another 30 minutes and then he's going to go home. This is outpatient surgery. It's done with a tiny 1/4 inch incision. There's almost no bleeding. We lose generally about maybe 10 to 20 drops of blood. In this patient, we lost probably 40 drops of blood, which is nothing, compared to open surgery where you could lose 20,000 drops of blood. So losing 40 drops compared to 20,000, there's no comparison. Also, the Deuk laser disc repair patients do not take narcotic painkillers because of our surgeries. They don't need it. They just take a Tylenol and a muscle relaxer. If you have open surgery like discectomy or fusion, you're going to need powerful, dangerous narcotic opioid painkillers, and they are dangerous. So it's the best thing if doctors refer their back pain patients to the Deuk Spine, where we actually have treatments that are very safe and the most effective treatments in the world to cure your back pain. All right.
Alrighty.
What do we got?
This next few questions are coming from Stuart on Facebook, asking, as I understand, it's a disc. As I understand it, a disc cannot heal. Is that true or false? Or maybe I was saying prone, Prone. Sorry. So can a disc, so to speak, heal? Many say no. What do you say, Doc?
Stuart, thank you for clarifying that. Yes, prone means laying on their belly, and yes, this patients that we do their lower back and the thoracic are on their belly. As far as the disc healing on its own, when the disc is injured, okay, if so when a disc is to get anything wrong with your disc, you must have 2 things happen. 2 things. Okay. All right. Let me start over. The disc is extremely simple. It has 2 parts. One is a ring around the outside of the disc called the annulus fibrosus, and it's literally made out of collagen and elastin, layers upon layers. As a matter of fact, around 20 layers of collagen and elastin, and it is a ligament because it holds one bone to another, the bone above to the bone below. Okay, so the disc is, outer part of the disc is a ligament that literally holds the top bone to the bottom bone. It's a ring called the annulus fibrosus. In the center of the disc is this material that we call the nucleus pulposus. It's just a name, but what the nucleus pulposus really is it's a highly organized, mostly water, 80% water, but it's made up of glycosaminoglycans and proteoglycans. So what are those? Proteoglycans are long protein chains with sugar. They're actually sugar protein molecules, and they hold water. They bind water and hold it there in the middle of your disc. Glycosaminoglycans are very similar, okay? And they're combinations of sugars and proteins and some fat. Point is, this nucleus pulposus is made up of small biomolecules that bind water, hold water. That's why the middle of the disc, the nucleus, is mostly water, okay? However, it's not liquid, it's solid, all right? It's like Gouda cheese. It's not really hard like a cheddar, all right? But it's semi-soft. It's compressible, and if you press too hard, it fractures, it breaks. So you have this ring, the annulus fibrosus, and you have a jelly, or we call it a jelly, but it's the nucleus pulposus. It's a semi-solid. What has to happen to get a disc injury is, number one, trauma, force, must be applied to the spine. That force does two things. Number one, it's so powerful it rips a hole in the annulus fibrosus, called an annular tear. That's the first thing that happens, but it happens concomitantly at the same time as that very powerful force crushes the nucleus pulposus. Imagine crushing a piece of Gouda cheese. If you smash it hard, crush it with your fist, it's going to break into little pieces, right? We call that fragmentation. Now, all of this was elucidated and discovered at Deuk Spine Institute. This is not something that I read about. It's not in the books. It's not on the internet. I literally discovered this process by treating patients endoscopically and looking at the disc, looking at the fragments, and understanding what's happening with inflammation within the tear and causing this collagenization of nuclear fragments. Point is, to make it simple, your first incident of trauma rips a hole in the annulus in the back of the disc. It crushes the nearby nucleus, fragments it into pieces, chunks. And then the second thing that has to happen is you push those pieces out. Those little fragments of nucleus, push them out into the tear. You push them out of the disc into the tear. And so you have what's called a herniation. Now there's two types of herniation. One is when the fragments go beyond the wall out here. These are epidural fragments. And then you have fragments that are in the wall, still stuck in that thick wall, inside the tear. All right, those are called interposed herniation, right? Interposed herniations. So it is actually the interposed herniations that elicit the inflammatory response that cause back pain. And that's what I discovered over the last 20 years. I discovered it 20 years ago. And I've been talking about it, teaching about it, publishing about it, but people don't listen. You people listen, but doctors don't listen. They don't want to hear about it, all right, for whatever reason. They got special interests. Either they're preserving their delicate egos or they're just have ulterior motives and they're on the take by some company that doesn't want to acknowledge the truth. But this is the God's honest truth. So trauma tears the annulus, fragments the nearby nucleus, pushes, and then secondary activities like bending, twisting, playing golf, playing soccer, going to work, lifting weights, you push those fragments into the tear and outside the tear, causing back pain and leg symptoms. That's what happens. So your question was about the annulus tear healing itself, the disc healing itself. The herniation, can it heal itself? The answer is no, it cannot. It cannot heal itself. What can happen is your symptoms can get better. You'll feel better because what happens is you go pick something up, you're helping your friends move their furniture. The next day your back's hurting because you got inflammation. What caused the inflammation is the herniation. Come on in, Dr. Berndes.
Out of the oven.
Oh my Lord, what do we got here? Gifts
Cherry
from
almond cookie.
gifts from a
Maggie.
patient. Gifts from a patient. This is what we live for here. Gifts from a patient. You guys see that? It's a lot better looking than I am. What do we got here? Cherry what?
Cherry almond cookies.
Cherry almond cookies, my friends. Cherry almond cookies. Holy moly. Are they both cherry almond?
The other one is that's one is the peanut butter one.
All right, let me show you the other thing that our patient cooked for us because they love us here at Deuk Spine. Okay, I am sorry I can't share these with you guys through the camera. Can you see that?
Yes, we can.
Peanut butter chocolate chip.
Mhm.
Henry?
Later.
Henry is resisting the temptation. But I shall not. But I won't eat in front of you guys. At least I have the decency not to do that. Now, I'm very happy that Dr. Berndes brought these to me because had he not, they would have disappeared. My nurses and staff would have gobbled them up shamelessly, leaving me nothing but empty space. Getting back to the question, can the disc herniation heal itself? No, it cannot. Can a disc herniation feel better on its own? Absolutely. If you give it time, it will, the pain will go away usually, at least in the earlier stages of herniation. But then there becomes a time later on when there's so much herniation stuck in that tear or outside the tear that it just causes constant inflammation and pain, and that pain never goes away. That's typically when people are so desperate they come to us for surgery. Don't get to that point. Fix yourself before you get there. Come to Deuk Spine. We're the only place in the world that literally treats the exact source of back pain and neck pain. You guys need something?
Yeah, they were just closing the door.
Just stay away from the cookies.
Yeah.
Stay away. Where's my bat?
Want to do extra?
Sure, we'll do Expo. What's that bat called in The Walking Dead? The one that Negan had? He had a name for it.
I'm not sure. Oh, with the spikes on it.
Yeah, it had the barbed wire on it. All right, don't let me. It's Lucy or something like that, right? Wasn't it?
Remember
Lucy?
13 Ghosts? It was one of those two.
Anybody know
I
the
don't
name
watch
of Negan's bat from Walking Dead? I think it was Lucy or something like that.
I don't watch one.
It's been a long time. I love Walking Dead. The beginning, first like 6 seasons. Any questions?
Yes. Next question from Stuart asking, are you diabetic?
Am I diabetic? Yes, I am diabetic, Stuart. I am. I am diabetic, and I'm not ashamed to talk about it. I've been diabetic, well, at least I've known that I'm diabetic for about 5 years. I discovered it when I was doing research on corals. I was trying to discover a cure to corals in the coral reefs dying, and I found the cause of coral reefs dying, but I could not. I was working on the cure. I was up late at night every night, come home from work here. I'd go to my lab in the bottom of my house in the basement, and I was doing experiments for about 8 hours a night up until 2, 3, 4 in the morning on corals. And I would just be drinking gallons of water and, obviously peeing like crazy. And I'm like, why the heck am I so thirsty? And then finally it dawned on me that I was diabetic, right? Talk about like right under your nose, the diagnosis. You're peeing all the time. You're drinking all the time. I should have known, but I didn't. Doctors make horrible patients, and I just didn't think I had anything wrong with me. But then I got my sugar checked, and it was 400. And I think my hemoglobin A1C was 12.2 when I was diagnosed. 12.2. Think about that. It's terrible. So I got on medication, and I just say that I've improved my diet somewhat, but I'm not perfect. But my hemoglobin A1C is now under 6, so just under 6. So I'm pretty well controlled. I strongly recommend anybody with diabetes take it seriously. Diabetes is one of the worst chronic diseases of our generations, and it can cause you to lose your vision. You get neuropathy, you stop feeling with your hands and feet. It causes so many problems. I just can't go through them all, but there's too many to name. It's at least 50 different diseases caused by diabetes. All right, but thanks for asking. But I'm well controlled now.
Lastly, from Stanley on YouTube asking, the procedure for this patient appears to be removing all scar tissue. Is this the primary procedure for most patients to relieve pain and inflammation?
What was his name?
Stanley.
Stanley.
Yeah.
Hi, Stanley. Thanks so much for joining us. Stanley is asking a great question. Dr. Deuk, you're in there with the scope. You're showing us all the scar tissue. Is that the main purpose of your surgery? The answer, Stanley, is no. Scar tissue itself doesn't hurt. It doesn't cause any pain at all. But the primary goal of this surgery is debridement of the annular tear. Now, what does that mean? If your disc gets traumatized and you rip your annulus and then it comes back together, but there's still a tear there, you can actually heal that tear. Your body wants to heal it. The only reason you don't heal the tear is because before the tear heals, you push out a piece of herniation like that, and it gets stuck inside the tear. And then the tear can't seal because the herniated nucleus is sitting there blocking it. Now, not only does the nucleus block the tear from sealing, it keeps it from closing, but it also gets your body's inflammatory system to come over and start attacking. And then you start getting all this red stuff called inflammation. And that's what we're seeing inside the tear. So the primary goal of the Deuk laser disc repair, the only surgery in the world that cures back pain from a disc injury, is to remove the herniation, remove the inflammation, and because the scar tissue is right there holding the herniation there, you have to take out some scar tissue too. The scar tissue also pushes on the nerve root next to you, and it crushes the nerve and causes radicular symptoms like weakness, numbness, tingling. So I got to remove that real thick cheese scar tissue. It's like probably more like a mimolette, very firm and crushing on the nerve root, not like a soft cheese like a Gouda. I hope that answers your question.
That is it for questions.
All right, we'll be back with one more surgery. Our next patient comes to us from Kuwait. He flew halfway around the world to get his neck fixed and his back fixed. We already fixed his back Tuesday, 2 days ago. He has 100% back pain is gone. He is so happy. He's been walking around with a cane and a crutch over in Kuwait. He's a big shot over there. He knows everybody. And now he's going to walk without a cane, without a crutch. And he did a testimonial for us. Yeah.
He's such a lovely
He did
guy.
a testimonial. You're going to see it. He speaks in English and Arabic.
He's awesome.
And, we love our patients. I love my patients. Why? Because they're smart people.
Yeah.
They're good people. They're honest people.
Yeah.
There's a lot of dishonest people out there, and I hate dishonest people. I really do. I can't stand them. I can't stand treacherous, dishonest people who try to do what's good for themselves at the expense of others. And I love people who are kind and intelligent and considerate and compassionate. That's my kind of person. Those are the kind of patients that I seem to attract at Deuk Spine. Of course, we don't discriminate. If you're as evil as Satan, we'll still fix your back. Maybe it'll make you a better person afterwards. I hope, right?
Yeah.
Yeah. So anyway, it's been a pleasure. We'll be back in about 15 minutes with our last surgery of the day. We're going to fix this gentleman's neck pain. He's got facet joint pain and occipital neuralgia. Whenever he turns, it hurts.